Centuries ago, amidst the fog of revolution and the thirst for independence, our founding fathers found solace in the warm embrace of coffee houses. These establishments were not just places for a hot brew. They became crucibles of free speech, where groundbreaking ideas were brewed, stirred, and served. In those hallowed halls, notions of democracy, liberty, and justice were not just idle chatter. They were debated with passion, shaped with precision, and forged into foundations of our great nation. Today, as we find ourselves amidst a whirlwind of social change, political divides, and pressing challenges, we need to rekindle that spirit. In these spaces, we can confront the most consequential social issues of our time, not as adversaries, but as allies in the quest for understanding and solutions. To the coffee houses willing to join this mission, let your doors be wide open, your atmosphere inviting, and your tables a meeting ground for diverse voices. In the spirit of unity, dialogue, and progress, let's come together and meet on the Coffeehouse Tour. Here's to the future brewed in the past. Hello everyone, I'm J.R. Larson, and today we're at Dream Shot Films in Fairfax, Virginia, in the shadows of Washington, D.C. The Coffeehouse Tour is a community conversation. Our objective is to get people to talk together about the most consequential social issues our country faces today and consider bold solutions. These are conversations powered by citizens of all ages, social and economic statuses, different backgrounds and beliefs. Our goal is to bring you the constant variety of social topics and opinions in a timely and unbiased manner. On our program today, we'll tackle the subject of affordable health care. Affordable health care is a critical issue worldwide with implications for society's well-being, economic stability, and social equity. The top social questions related to affordable health care often focus on access, quality, and sustainability. These questions reflect the challenges in ensuring that all individuals can obtain the health care services they need without suffering financial hardship. Here's a closer look at each. 1. How can universal access to health care be achieved? How can quality of healthcare services be improved while controlling costs? How can healthcare systems be made sustainable for future generations? On today's program, we have 3 guest contributors. Please welcome to our program Ike Fessler. Ike is a recently retired military officer after 27 years in the Navy and Air National Guard. Ike works for a local military association advocating for increased benefits for National Guardsmen and their families. He resides in Northern Virginia and is passionate about the community, military initiatives, and America's place in the world. Please welcome Jason Daniel Thompson. Jason is an actor with over 20 years of experience. Jason's a professional sales training consultant for the health and fitness industry. He's an advocate for unfiltered and independent thinking and is a welcomed addition to our program for his fresh perspectives and reasonable insights. Please also welcome Shalon Lizelle. Shalon is a proud mother of 3. Shalon has worked as a registered nurse for 23 years. She holds associate and bachelor's degrees in nursing, as well as a master's degree in business administration. Shalon is an actor, model, published writer, YouTube podcaster, and beach lover. Alrighty, everyone. Let's jump right into our discussion with our first topic. How can universal access to healthcare be achieved? And we're going to start off with Ike.
JR, thanks for having me today. And a very important question that we're addressing today. And this question focuses on how everyone, regardless of their socioeconomic status, has access to essential health care. So what I would like to use as an example, my daughter. My daughter is a mental health professional. She owns her own counseling practice in Eastern Tennessee. And she deals daily with a myriad of insurance regulations and insurance providers. And the payouts from providers differ based on the established rules and regulations that they have. So she spends a lot of time dealing with that. Additionally, my daughter herself has an autoimmune disorder, and she has very difficult times every year acquiring healthcare insurance as a business owner, and it becomes increasingly more and more expensive every year, versus someone that has a company-sponsored insurance plan that doesn't have those concerns or those strains. So it's a very complex issue that we must address at the core. For-profit insurance companies, and I'm a big believer that there should be one price for all services, regardless of your socioeconomic status. Whether you can afford $50 for a prescription or $500 for a prescription, your prescription should be the same price across the board. It should not be necessarily based on your ability to pay. And also with those payouts that come from the insurance companies, those could be standardized to a degree based on the level of service and the exact service that you're getting. If you are getting shoulder surgery, but your insurance provider only pays out a certain amount, why should my shoulder surgery cost me more if it's the same procedure? So there should be a more standardized process. And we could look at the military healthcare system as a footprint, although it's a much smaller footprint. The military healthcare system is fantastic, and everybody receives the same level of care regardless of their rank.
So it can be done.
It can be done.
All righty. Jason, what do you think?
Well, I think that's the million-dollar question. It reminds me of the tax code. No one really understands it. There's a million different numbers, a million different codes. No one really gets it. It's a different price for Ike. It's a different price for me. And I just want to be like Ike, you know? And so I look at it and I say, well, how can we simplify this, right? I think people need to be aware of, I know I've worked for different businesses, and you sit in front of the meeting when it's time for everybody to do the November rollout. And there needs to be a spokesperson, because no one understands it unless the spokesperson is there and they're explaining it to you, and everyone is sitting there with deer in the headlight stare on their eyes. And ultimately, I think we need to be aware of what's out there. And I do think there shouldn't be a one-size-fits-all approach, but there does need to be some sort of simplification. I think we get increased more access. I love telecare. I've used that myself. I thought that was fantastic. It prevents you from sitting into an office and feeling like you're a number. I also like some of these boutique doctor options, you know, VIP sort of things. But I think the answer truly lies in the balance between social programs and maybe sometimes even subsidized by the government. I'm not a big proponent of that normally, but communities, charities, and then the private sector, of course. I think if we create more competition, we create more options for people, and the prices get driven down. I think the more options, the better. And this allows people to choose what works best for them in their specific scenario, as opposed to one size sort of fits all. So maybe that's where the simplification comes in. You just have more options, right? But you understand them, and you have access to someone that can explain this to you.
Gotcha. And Shalon, what's your point of view? You might have a point of view on this.
I very much do have a point of view on this. Thanks, JR. I think when we talk about universal access to healthcare, we need to incorporate the financial piece of that. You know, about approximately 8% of our residents in the United States are not insured. It is critical to have those types of people have access to care. We have a model in the United States where primary care physicians are the basis of the care and providing preventative care for patients as well. However, what we are seeing is a declination of primary care physicians. Many organizations and many healthcare systems are shifting their models to nurse practitioners and physician assistant care, where they can focus on the well care and the preventative care itself. So I think there needs to be multiple different avenues to address when it comes to the financial piece of that. Also, many patients will not seek care if they feel like they cannot pay for it. So those programs are very important in that aspect. I would also like to talk about rural access to care. You know, there may be some facilities that are present in the rural areas. There may not be, and patients may find, you know, difficulties traveling to where they can get care. So having mobile units that can go out into the rural areas, having virtual care and home-based care are also critical aspects of having access to care in the United States.
That between the three of you, that covers a lot of ground and opportunity
Get
for
it out.
crosstalk. How about we
Yeah.
take a minute and see if you've got some second thoughts?
Yeah, JR, I'd also like to add on the affordability of care. There should be legislation at the national level because currently, if I live in Virginia, but there's a cheaper healthcare plan in Kentucky, I'm not allowed to buy that plan because I live in Virginia. So being able to cross state lines and purchase healthcare in a different state, if it's a provider that provides it at a lower cost, I feel that that should be
And
explored,
get the care there.
or to get be able to have that care, but it's just based out of another state, but be able to cross state lines
Mhm.
instead of it being within your geographic area.
Excellent. When we come back, we're going to take on our next question. How can the quality of healthcare services be improved while controlling costs? We'll be right back. That's some very good discussion. It does lead to this next question. We're back. How can the quality of healthcare services be improved while controlling costs? Shalon, what are your thoughts? Leading off.
Thank you, JR. Yes, and I will say that in my former position, we were focusing on this. So I think healthcare systems certainly need to leverage technology when it comes to improving quality outcomes. Having access to innovative technologies and using those technological advances will certainly improve quality outcomes and has been proven to improve quality outcomes for patients. Organizations that are procuring technology are definitely at the top echelon of the healthcare industry. And you certainly see gains on indirect costs as well. Meeting customers' demands, many customers and patients are educated now to what is out there, and they want the new technology and they want to have procedures with new technology. So those healthcare systems that are acquiring this technology certainly are providing what the customers want. And then also a strong point here as well is partnering with the suppliers. As you know, acquiring technology can be very expensive. So healthcare systems that are innovating and providing different means to acquire technology are proving to be very positive on their side. Also, I think we need a strong supply chain involvement as well. Supply chain teams that can negotiate great contracts with suppliers also provides lower cost alternatives as long as the quality is not being impacted. And those supply chain teams that have the quality aspect and are looking at that and reviewing to make sure they're bringing products into the facilities that are not impacting that care.
And those are some good points from somebody that knows the profession well. And over to you, Ike. How do you think that the quality of healthcare services can be improved while controlling costs?
Thank you, JR. And thank you, Shalom, for your perspective on this working in the healthcare field. I would go back to the previous segment, and I mentioned one price for all services. How can that improve care while keeping costs low? If there's a set price for a procedure, every company knows that's the price that is set for one procedure. The quality of care will continue to go up if there's not a competition at the price points. So if I don't have insurance and I go to the doctor, I'm not going to be prescribed $2 aspirin. If you go to the doctor and you have the gold standard of healthcare, you might be charged $50 for an aspirin. That causes competition, which will decrease the quality of care in the coming years because the disparity will continue to grow as inflation and the economy grows. Additionally, we need to take advantage of the technological advances in medicine. We also need to make sure our supply chains are all on the same page and reduce duplicity of effort. There's a lot of things in society, healthcare and industry, where there's duplicity of effort. People are doing the same thing 2, 3, 4, 5 times. Whereas if we just streamline it and we're doing one thing one time, that overall reduces the wasteful spending, the wasteful duplicity of efforts, and that will balance out the quality of care where everyone knows they're paying the same price for the same kind of care. So I would say that's a couple of ways you can start on this path. Keeping costs low is probably a larger equation that will likely have to be addressed in a legislative level at the national level to impose some cost controls on these outstanding ways of some companies charging one price for a procedure versus not as much for another procedure. And when I walk into the emergency room, they should not ask me if I have insurance, because then that dictates what you pay.
Very thought-provoking. Even myself.
Well said.
Jason, over to you.
Well said. I like both of these solutions here. I think the elephant in the room, though, that we haven't discussed yet, you were touching on it for a second there, is all these solutions are great, but ultimately, if we're looking for the cure, no pun intended here, the cure of the underlying cause, until we get the lobbyists out of bed with the politicians, out of bed with Big Pharma, out of bed with the food corporations, none of this matters, because they're not going to change it, because they all have an incentive to make money, okay, because they're all in bed with each other. So to me, I mean, you look at the commercials on TV. We advertise drugs on TV. No one ever blinks an eye. It's in every Super Bowl commercial, right? So there's something wrong with that. There's something inherently wrong with that. And I think it's legal to advertise those. The food companies feed us their bad foods. No one says a word. The FDA is involved. The food pyramid is a scam. And then basically they're making us sick. We're eating processed food. The drug corporations want us on all their non-generic expensive drugs. We get more sick. We get more of their very expensive drugs. And then we go to their surgeons and to their doctors under their insurance companies to fix us. Mm-hmm. Fix us not mean to cure us, but also means to continue to treat us, so they're making more money. So I think until that gets solved, nothing's going to happen. The problem there, obviously, the challenge is that, guess what? Who's going to be legislating that? The very same people. So telehealth is a great option. I think that's a great way. Like I say, I've used that. But I think competition in the private sector is going to ultimately give us more options, drive the price down like anything else. Innovation, technologies, emerging technologies all come from that competition, and we should embrace that.
So I hear we should melt the self-licking ice cream cone and apply a little bit of Drucker economics, get rid of the inefficiencies, and how about some go-backs?
Yes, I will second what Jason said. We have a sick model care in the United States, unfortunately, and the emphasis should be on, instead of living to eat, we should eat to live.
Love it.
And focus on food, healing ourselves as opposed to drugs.
Preventive care as well. I mean,
preventive care and all these preservatives that we have in these foods that are making us sick. Yes, it preserves the food on the shelf life of a loaf of bread, but what's it doing to our insides? And the domino effect of that is we have to go to the doctor to get a pill to subside that side effect. And then that pill causes another issue that we have to take another pill for to eradicate that symptom.
So when we do come back in our final block, we'll look at affordable health care from a different angle. How can healthcare systems be made sustainable for future generations? And why would that be a call to action? We'll be right back. And we're back. In our final block, we look at affordable healthcare from a different angle. How can healthcare systems be made sustainable for future generations? And why might that be a call to action? And first up, batter up is Jason.
Well, I think we've all had our own individual health experiences. I know myself, I've been through some battles, and I went through the medical merry-go-round, if you will. You know what I'm talking about. And it's very frustrating. You feel like you're on an island. It's scary. And I got to say from my experience that what I learned from it was you have to be your own best advocate. You have to be educated. You got to go get your own education, because the system is not set up to help cure you. It's not set up for you to be educated. It's set up for them to make money. And then there are some very good people in the industry, don't get me wrong, one to the left of me. But ultimately, we have to get into accountability, lifestyles that are healthy. We need to educate ourselves. We need to get into preventative care. I know a lot of insurance companies now are going that route, giving you incentives to lower your costs if you're going to the gym a certain amount of days a week, if you're eating a certain way, if you're doing X, Y, and Z and going to the doctor this many times. And so I think that's a great way to start that initiative. Demand more choices, break up the racket. We need to do that. We need to demand more choices out of our healthcare providers. I love telehealth. I love anything that's going to lower costs, but also incentivize more innovation, right? All these cures that we talk about happen because there's an incentive to get better. There's an incentive to innovate. There's a competition to make money also. There's a financial incentive. And so I think we need to double down on that. And I think we need to encourage future generations to really take onus of their own health and their lifestyle, because no one's going to do it for you. The government's not going to take care of you. Clearly, they have alignment with the food companies to deal with it in their way.
Mm-hmm. Shalon, in your mind, with your experience, how can healthcare systems be made sustainable for the future generations?
Yes, so sustainability is certainly at the forefront of many different organizations, their C-suite conversations, decreasing their carbon footprint in the environment, having a positive balance sheet, as you can imagine, will set a company up for future as well. And we know there's been decreasing amounts of reimbursements from payers, not only the government, but also from the private payers as well. And so any policies that the systems can incorporate into that to prevent any kind of negative contribution margins will help sustain them for the future. Also, meeting consumers where they are currently. After the pandemic, there were many patients that did not want to go into the hospitals because they did not want to get sick. So incorporating outpatient services that are out in the community, having a strong home care program. And what I mean by a strong home care program is where the team knows the patient, not this, I'm having symptoms and I'm just going to drop by, send a nurse to take care of the symptoms. So just knowing the patient as a whole. Also, having points of care in the community as well. And then I think the other point that I want to make really is with the payers themselves and having teams that are negotiating strong contracts with the payers. Payers consistently decline payment, they deny payment, they delay payment, which the systems are not getting those funds into the system and being able to take care and sustain. So I think those are all important points that systems need to address, as well as energy for the environment, having alternative energy programs. Our grids are maxed currently in the United States. And so healthcare systems that can provide alternative energy measures is great.
Thanks a lot, Shalon. And Ike, we want your perspective as well.
Great points from Jason and Shalon. I would go back to what proverbial beating the dead horse, one price for all. That makes things sustainable for future generations. If I know what I'm going to pay when I walk in the door, regardless of my insurance plan, that makes it sustainable for future generations. Additionally, preventative care. We have to take care of ourselves. We know what our body needs. We know what our body wants. We shouldn't rely on what some flashy Super Bowl ad says that's going to make our skin look better or is going to make us feel better. We have to do the preventative care, working out, getting vitamin D, eating healthy, those sorts of things. Also, we got to get the lobbyist money out of healthcare. And I know we live in a capitalist society. Companies are in the business to make money, to take care of their shareholders. But at some point, people just have to do the right thing. Taking the lobbyist money out of this equation would go a long way in ensuring we have sustainable healthcare for future generations. Just doing the right thing, and I can't say that enough. We've seen many docuseries on opioid epidemics and fentanyl and overprescribing drugs. Lots of kids are overprescribed medication, in my opinions, when there are alternative means. Instead of having a medication solution, they should have an alternative solution. And that comes from empowerment from the family structure and having just a preventative care plan, which also eliminates these chronic illnesses. A lot of these illnesses that people have now that they're taking pills for are created because they're taking pills. They're taking pills they don't necessarily need to have, but they're being told that they need to have. And from societal pressures, social media, they tend to do so. So one price for all services, preventative care, societal influences, and let's get the lobbyist money out of the healthcare industry and do the right thing.
That's a lot that we can possibly. Is it doable?
Potentially.
Yeah.
We are America. Anything's doable.
There you go.
That's right. There is hope. And let's take this last moment or two to do a bit of crosstalk on some of the ideas. Any go backs?
Well, I wanted to say, I wanted to add on kind of what you were saying, if you don't mind. You know, your doctor is not God. We rely on the experts so much. And I think, you know, they're not taught nutrition, which is ultimately your best drug. Okay, they're not taught exercise. They don't know anything about it. The advice I was given for some of the things that plagued me for a while, you wouldn't believe. From doctor to doctor, it varied from doctor to doctor. It was things were just flat wrong. This is supposed to be the expert. They're not taught those things, and therefore they're not going to give you that advice. So we need to be, again, we have to go back to being our own best advocate and really know our own stuff and know who to talk to.
Yeah.
I second education.
As we close today, I want to thank our guests and all of you joining us in this thoughtful exploration of the issues that shape our nation and our values. Remember, it's through respectful dialogue and a steadfast commitment to our principles that we can navigate the complexities of our times. Stay tuned. Future programs will tackle more consequential social issues, including drug addiction, border security, education, and religious freedom. Goodbye for now from the Coffee House, where every conversation is a step towards a brighter and more grounded tomorrow. The Coffee House tour has been sponsored by Jiffy Images, residential and commercial real estate photography, and Odyssey America Media. For a printed transcript of the Coffee House tour, send $1 and a self-addressed envelope to Dreamshot Films, 4580 Fair Valley Drive, Fairfax, Virginia 22033.